before I go further, I have a handout that I would like my staff to distribute. And I want to tell you how Medicare has personally touched my life. What they are distributing is just a story about somebody very near and dear to my heart, and that is the aunt that I was named after. As I said before, my name is Martha Khlopin, and I was named after my mother's sister, whose name is Martha, and she lives in New Jersey, so 5,000 miles away. So, I've been doing Medicare for, quite some time, over a decade, and my mother's 87, so for the last 20 years, she's been getting information every year about Medicare and choose this and choose that. So it's a job, and I love my job, but the job became even more special to me when I got a call from my auntie last October. She called me and she said, "Oh, honey, I want to talk." I go, "Oh, Auntie Martha, I can't talk to you right now. I'm on my way to do a radio show." Every week, I do a radio show called A Medicare Moment with Martha, and all we do is talk about Medicare every week. Can you believe somebody can talk about Medicare every week? I can't believe it either, but we somehow managed to do it. But anyway, so I told her, "I can't talk, I'll call you back." So she said, What is there to say about Medicare? I got a red, white, and blue card when I turn 65. When I go to the doctor, if I go to the hospital, that's the card that I use for my services. So I said, "Well, Auntie, it's a little bit more. We'll talk." So around Thanksgiving, we had an opportunity to talk, and I talked to my Auntie Martha about how original Medicare works and how other Medicare delivery services work, like Medicare Advantage plans. So she said, "It does sound kind of interesting," and we talked a little bit more, and we got her enrolled in a Medicare Advantage plan. So she went from original Medicare, red, white, and blue card, to a program by private insurance companies called Medicare Advantage. So that was around Thanksgiving. So when you enroll in these plans, they become effective the first day of the following year. So January 1st of the following year. So New Year's Eve, I'm, making my phone calls. How many people make calls to their relatives on the mainland? Happy New Year? Maybe one or two. Okay, well, I do it all the time. So I called her and I said, "Hey, Auntie Martha, Happy New Year, almost." And she said, "Oh," I said, "How's everything?" She said, "Fine." So that was good. So I meant to call her the next day, because I always call my relatives and friends on New Year's Eve, and then I call them the next day. I don't know why, but I do that. But I never did call her. And on January 2nd, I got a call from my cousin. And my cousin called to tell me that his mom, my Auntie Martha, had suffered a massive stroke, January 1st. I mean, I was in shock, because she's very healthy. We come from Irish stock. We are McClintons. Believe me, I look this way, but I am a McClinton. Somewhere in here is a Russian, Irish, whatever. But very, very strong people. But I was just shocked. So what I did is I had my cousin kind of put down his thoughts, and we put a little story together. And I'll just read just the first part. It says, "Nothing prepares you for the call telling you that a loved one has been rushed to the hospital after suffering a massive stroke. When it is your mom and you live thousands of miles away, it is even more disturbing." Jimmy Wilson received that call on January 1st, 2013. He was speechless and in a state of shock. He had just spoken to his mom on New Year's Eve, and she seemed fine. Little did he know that just 24 hours later, he would be at her bedside, kissing her forehead as she lay still and unresponsive in the intensive care unit. Later that day, Jimmy was directed to the finance office. The rep said his mother had a Medicare Advantage plan that became effective on the 1st, the day she suffered the stroke. She told Jimmy that under original Medicare, her previous coverage, his mom would have been charged a deductible of over $1,100 due at discharge, and she would have been billed for deductibles and out-of-pocket costs that could have reached into the thousands. I mean, can you imagine? You sign up for a plan, and the day it becomes effective, you have a catastrophic illness. So again, Medicare has personally touched my life. I'm so thankful that I'm in this business and I can educate people about how Medicare works and help them choose a plan that if you should suffer a catastrophic illness, at least you have the proper coverage to take care of your healthcare needs. And I'm very, very happy to say that my Auntie Martha has had a full recovery. She had 10 days in ICU. She had 60 days in the hospital. 60 days in the hospital, and she had 6 weeks in skilled nursing. Anybody want to guess what her bill was after that? $1.5 million. $1.5 million. How many people have $1.5 million in the bank account that they want to spend on that? So her Medicare Advantage plan really kicked in and did a wonderful job. Her out-of-pocket for that was, a few $100s, and she had a full recovery. And I just talked to her a little bit before this session, because I always love to share this story, because I think it's important. Before we talk about how Medicare works, what is Medicare? I don't like Medicare. Medicare is broken. You need to know it's a very, very valuable benefit, and it's definitely one that you should learn as much as you can about it. So enough of my soapbox. Let me go ahead and get started, if I can find my presenter thingy here. And if you have questions, I'll run through the presentation and we can take questions after. Sound good? Okay, great. Let me see if I can make this work. So today we're going to talk about how to make Medicare simple, because I think it's simple. A lot of people, when they have to learn about Medicare, they get very confused. And they tell my team and I that it's more like a maze. And, the little cartoon here says, hello, anybody? So I want you to know that should you have questions about Medicare, there are great people in our community who are educators and can help you navigate through the Medicare system. Also, I must say, I've been working with them a lot because of my Auntie Martha, and I call 1-800-Medicare. They're around 24 hours, 7 days a week, and believe me, I've called them late in the midnight hour, and they are very, very helpful. So 1-800-Medicare, they're open 7 days a week, 24 hours, should you need to make that call. Today's agenda, I plan to talk about the ABCs and D of Medicare. There's a D now, came around in 2006, and I might talk a little bit about coordination of benefits between Medicare and employer coverage, retiree coverage, or if you have COBRA. Because there are many, many people, especially in our communities, they work well past the age of 65. I've even met people when I go out and do presentations, they're 90 years old. They come up to me, I don't know it at the time, they come up and they go, I'm thinking about retirement. And I've been thinking about it for a while, and I'll say, oh, well, how old are you? Oh, 90. I'm like, okay, you can still get Medicare, at 90. Just to give you some basics, what is Medicare? Medicare is a federal health insurance for those who qualify due to age or disability. The program has oversight by the Center for Medicare and Medicaid, and Medicare benefits are decided by Congress and not by the plan. Sometimes when we talk to people and they find out that there's a benefit that maybe they like to have, and Medicare, we tell them Medicare doesn't cover it, they think it's the insurance plan. They say, well, why don't you cover Botox or some kind of cosmetic surgery? I'd like to get some permanent eyebrows or something. And I understand that, but Medicare decided not to cover those things. So they have to decide to cover those kinds of things. Also, Social Security handles enrollment and eligibility. Now, for those who may not know why Social Security handles that, I'd like to tell a story for those of you who are still working or when you were working. Every time you had a paycheck or some money came out, right? Everybody with me on that? Does anybody have any idea over a working lifespan of, say, 30 to 35 years, how much came out? Anybody? Nobody? Okay. Well, I'll be the one to share the news. If you are contributing to Medicare taxes, which qualifies you for Medicare when you qualify due to age or disability, you've put in about $150,000 to $175,000. That's what's been coming out of that paycheck. And if you add a little interest to it, that would come out to about $250,000. So that's how much you've put into the system. Who tracks that? Social Security. So when it's time for you to determine if you're eligible, it's time for enrollment, that job falls to Social Security. And Medicare actually administers the benefits and contracts with private insurers for those who give it at that time. So if you're thinking about, that $250,000, some people tend to think of Medicare as being some kind of a handout. It's absolutely not. Medicare is an insurance program that those of us who have worked or we've been married to a spouse that worked, we've been working for that spouse in the home, so we get to qualify from the spouse. We've put in about $250,000. So if you think back to my Auntie Martha's situation, where her health care costs just for that one event, the first day of this year, that's not bad. You put in $250,000, she got $1.5 million worth of services. Does that make a little bit more sense? Does Medicare start to make a little bit more sense? It's a really good insurance to have, and I'm happy she has it. Okay, what are the parts of Medicare? I'm going to do the parts of Medicare in two pieces. I'm going to talk about original Medicare. Original Medicare came about in 1966. It was actually signed into law in '65, but President Lyndon Johnson distributed the first red, white, and blue original Medicare cards that consisted of a Part A and a Part B. Part A is hospital insurance. It covers inpatient hospital care, that's your bed, room and board, skilled nursing, some hospice, some other things. And then Part B covers visits to the doctor, lab work, and different things like that. Does anybody know who received the first red, white, and blue Medicare card? I know everybody looks a little young, so you probably wouldn't remember back that far. But it was former President Harry Truman, and his wife, Bess, was the second person to receive. Oh, you knew the answer. Oh, I could have called on you. And his wife, Bess, was the second person to receive the card. Very valuable benefit. So in 1966, the only option you had at that time was original Medicare, Part A and B. You carry your red, white, and blue card. That's how you get your benefits. Now, Part A is premium free. You earn that from working. Remember that $250,000 with interest that you've been putting in? But Part B requires you, once you become eligible, to make a payment every month. Now that goes to Medicare, not the insurance company or the health plan. It goes to Medicare. For most people, 2013, I think it's about $105 or so. But the Part B premium is actually based on your income. So if your income is higher, you pay a little bit more for your Part B. I think what confuses a lot of people about Medicare is when you're working and you have coverage through an employer, you have open enrollment, nobody starts talking to you about the letters of the alphabet. I mean, that's kindergarten stuff, right? That's when we learn our ABCs. And imagine at age 65, you got to learn your ABCs all over again. So that's why I try to make this simple, because here we are back in school. The next thing that happened with Medicare around the 80s, a lot of people were telling the politicians that insurance was just getting too expensive and they needed additional help. So what was created was what was called Medicare Advantage plans and a Part C benefit. The best way I can explain Part C is to think of it as choice. You can have original Medicare, what former President Harry Truman had and his wife Bess, okay? Or you can have Part C, which is a choice, like Auntie Martha, remember? Everybody with me? You got to help me. I got to see you with me, or I just get dry. But anyway, Part C is a choice. So Auntie Martha, remember, she had original Medicare, excellent benefit, package of benefits. It was good enough for former President Harry Truman and his wife and others that followed. But in November of 2012, she made a choice, Part C, she made a choice, and she took Medicare Advantage. So what is Medicare Advantage? Medicare Advantage is when you get your Part A and Part B benefits provided by health organizations or insurers that are contracted with Medicare. So you have a choice. With original Medicare, generally about 80% of your expenses are covered, and you have 20% that you have to pay out of pocket. So just to do the math, If you had services for about $100,000, which is really easy to do, 20% of that would be $20,000. In a Medicare Advantage plan, it would work a little differently, and you would know up front what your out-of-pocket might be for a service. So Medicare Advantage plans greatly reduce what your out-of-pocket costs are. So it's your choice. If you want to stick with original Medicare, you can, but there's also a Part C available, again, C for choice, and that's the only difference, is that your benefits are being provided by an insurance company that has a contract with the government. And what they often do is they give you benefits beyond what original Medicare will provide. So that's really the difference. I think it's kind of simple when you look at it that way. In 2006, the politicians heard a lot about prescription costs. Prescription costs went through the roof. I actually have talked to people who pay $500, $600, even $1,000 a month for medications that actually really keep them healthy and keep them comfortable. So prescription costs got really, really high. So in 2006, prescription drug plans came into existence, and they decided to add another letter, and they called it a Part, can everybody see that? D. Part D has many parts, so I thought I would have one of my team members talk about it. Before I call her up, I just want to mention something that happened a few months ago. As I said, we do a radio show every week, and we talk about all kinds of things Medicare. So one week at the office, I got an envelope. I got something in the mail, and it was a bill. It was a bill for dialysis. And I said, oh my goodness. I said, I wonder why I'm getting claims. I don't do claims. So I was getting ready to send it off to the claims department, and there was a little note attached. And it said, thank you, AlohaCare. Thank you for the education. I was listening to the show, and I heard about the differences between original Medicare and Medicare Advantage, and I'd always been healthy, and I had original Medicare, but then I decided to sign up for a Medicare Advantage plan. And they didn't sign up for AlohaCare. I'll tell you, they didn't sign up for AlohaCares, but they signed up for a Medicare Advantage plan. And in the note, he said, a couple of weeks ago, I was diagnosed with a condition that requires dialysis. He said, I want you to see what my bill is. He said, I've been billed $6,000 a week, and that's what I will be charged for the rest of my life, because I'll need dialysis 3 times a week for the rest of my life. So $6,000 a week. So that's $24,000. And there was another bill, and it was for a hospital stay, which was $12,000. So here I'm looking at this $24,000, $12,000, $36,000. So he said, I want you to see what my out-of-pocket was because I had Medicare Advantage. $7.09. $7.09. So maybe that helps you understand why I love my job. If we do the quick math, I won't do the 6, I'll do 30. $30,000, 20% would have been his out-of-pocket. So for those $30,000 of charges, 20 times 30 is $6,000 when I went to school. So $6,000 is what he would have had to pay out of pocket. And again, because he will need dialysis for the rest of his life, that's what he would have had to pay out of pocket. So he's 75 years old. What can you live on if you're paying that much for your dialysis? So these plans work. It's important to learn about them. And again, I loved my job anyway. But when I see the impact that this education has on people's lives, I don't care what plan you choose. Just make sure you choose the one that works best for you. That's what gives me my true love for everything Medicare. So I'm going to call up Trudi Cannon now, and she's going to talk about Part D and how Part D works.
I'm a lot shorter than Martha. I had to move this down. Good morning, everybody. A lot of smiling faces, and people were here early. So that was nice. We were here early. That was nice to see. I'm going to talk about the Part D Medicare prescription drug coverage. If I can figure out how to do this. What am I doing wrong? Oh, here? Yeah. Thanks. Okay, as Martha indicated, Medicare drug coverage only became available in 2006. What happened before that? You paid out of your own pocket. I remember taking my mother-in-law once a month to get her prescriptions filled, and I was appalled because I'm working. I've got drug coverage through my employer. $900 a month for her medications. Who could afford that? And of course she couldn't. So my husband and his sisters, we all chipped in and helped pay for the drugs. But so people were very happy when prescription drug coverage came around for Medicare coverage. You can purchase that when Martha was talking about Medicare, original Medicare, is through Medicare, and your other choice is a Medicare Advantage plan. When Medicare started offering prescription drug coverage, they decided they wanted the insurance companies to handle that, because it was a newer coverage. So you can only purchase the prescription drug coverage through a private insurance company. You don't deal with Medicare on that ever. There are a couple of choices. If you have original Medicare, you can buy a standalone, it's called, a standalone Part D plan, and there are lots of them out there. But you can only have that with original Medicare, the standalone plan. Otherwise, you would have your drug coverage as part of a Medicare Advantage plan, because most of the Medicare Advantage plans do include your drug coverage, which is nice, and it makes it very convenient for you. The Part D premium, Martha talked about Part A is free, Part B has a premium. Part D can have a premium. If it's part of a Medicare Advantage plan, it's usually just bundled together with, if there's a premium for that coverage. But it is, if you buy a standalone plan, it is income based. So people who are making more money, you might be in a Medicare Advantage plan that has a zero premium, so you're not really paying a premium for that coverage. But if you make a lot of money, you would have some additional cost for the drug part of your coverage. Most of us in retirement aren't making more than $85,000. Is anybody making more than $85,000? I would like to, but so it's if you're making over $85,000, and the all insurance is based upon economies of scale, spreading the risk among lots of people. So if you do not take, and Medicare is insurance, right? So it's a kind of insurance. If you do not take your coverage when you are first eligible for it, there may be a penalty down the road when you finally decide to take it, but both for your Part B coverage and your Part D coverage. But there's lots of ways that works and lots of reasons that you might not have a penalty. But anyway, if you did, it would be 1% of the average drug premium. And the average drug premium right now is about $32, the national premium. Okay, so Part D, like ABC D on your medical coverage, hospital and medical coverage, Part D has its own stages as well for the coverage. And those 4 stages are annual deductible, initial coverage stage, coverage gap, or better known as the donut hole. That's how most people refer to it. And the catastrophic coverage stage. I'm going to just walk through each of those. Annual deductible. So the basic Medicare prescription drug plan has a deductible on it. If you are part of a Medicare Advantage plan instead of just having original Medicare, you may or may not have a deductible. A lot of plans don't require that deductible be met. But if you have a standalone plan, a Medicare Part D standalone, you will have a deductible. And that means, obviously, deductible. You pay the first X amount of dollars before the plan begins paying any benefits. And for this year, it's $325. Next year, we already know the figure, it's $310 for 2014. So it went down a little bit. That's a good thing. But like I said, in Medicare Advantage plans, you may not have a deductible, and in even some standalone, it's possible you would not. So, whoops, let me back up a minute. If you have a deductible, you pay $325, then the plan begins paying. And you begin paying your copayment, okay? Most plans just have a copayment based upon the tier that your medication falls in. And tiers you're probably familiar with if you've had Medicare or read about Medicare. There are generally at least 4 tiers of copayment, of coverage and copayment. So generic, we all know, is the least expensive drugs. Most of us try to get generic if we can because it's the least out of pocket to us. So generic, and then there's a preferred generic, there's a preferred brand, there's a regular brand, and your copayment for whatever your medication is goes up the higher the tier is, of course. So you start paying just your copayment. And copayments can be very small for generic drugs, as little as $4, $5, $10 for a month's supply of your medication. And you keep paying, and the plan keeps paying until, this is all in the initial coverage stage, until the costs for your drugs for that calendar year reach $2,970. That's the 2013 figure. That figure does change. Again, Martha was talking about Congress decides the benefits, and Medicare decides what are these maximum out-of-pocket costs and coverage stage is going to be. So you pay, the plan pays, and you reach $2,970 in any calendar year. Has anybody reached that amount in a calendar year? No, see, that's the good thing, okay? Everybody's very nervous about the donut hole because once you get to the donut hole, you have more expense. But nationally, out of the 53 million Medicare beneficiaries, only about 20% of the people ever reach that donut hole, ever have enough drug costs that they hit the donut hole. Now, for that 20%, I feel bad for them, but if they have very large expenses, there are even some other avenues available to them. But that's the figure, 2,970. And if you get there, you go into the you go into at that figure, go into the donut hole. When you hit the donut hole, basically the language says you're responsible for all your drugs. Okay, you're 100% responsible for your medication costs at that point. However, it's a very vocal, the senior population is very vocal. So when the drug coverage was introduced by Medicare, people were very happy to have it, and it's certainly better, even with a donut hole, it's better than not having coverage. But beneficiaries said, wait a minute, this is a lot of money when we get to that point, a lot of money out of our own pocket. Medicare, please do something about this. So Medicare has, in fact, been working on eliminating that donut hole, and they're doing it in steps, okay? So initially, you paid it all, then the next year, they gave some discounts, and the next year they gave some discounts. Right now, if you do reach the coverage gap with your drug coverage, point of service, what that means is Medicare has made arrangements with pharmacies directly. Okay, so it's not through your health plan, it's directly with the pharmacy. When you go to get your prescription filled and you're in the donut hole, you will receive a 52.5% discount on brand name drugs from the pharmacy and a 21% discount on generic drugs. Generic drugs are cheaper anyway, we know that. So that's for 2013. The Medicare plan goal is to eliminate the donut hole entirely by 2020. That's still a ways down the road, but you have that to look forward to if you're going to be aging in later to Medicare. And then, so you receive those discounts at the pharmacy while you're in the coverage gap until your yearly out-of-pocket drug cost reaches $4,750. If nobody here has reached the donut hole, then you don't have to worry about the catastrophic stage either. But because you'd have considerable expense at that point, if you reach the 4,750, then for the rest of the year, you have small co-payments for either generic or brand name drugs, 5% or a $2.65 copay or a $6.60 copay. And that's pretty much how the drug plan works. And Martha will come back up and talk some more about Medicare. Thank you for your attention.
Thank you, Trudi. That was great. I told you there was a lot of parts to the Part D. So there's a lot of parts to Medicare and a lot of parts to the Part D. And I know that was a lot of information, but I see another one of my team members has arrived. Is that Scott Flazer back there? Scott Flazer is here, Trudy's here, I'm here. We have other folks here, and we'd be more than happy to answer any specific questions that you might have about any of these issues. Let's take a quick look at eligibility. Eligibility for Medicare is based on age or disability. You need to be age 65. So what is so good about turning 65? You get to look at Medicare as an insurance plan. That's what's good about turning 65. At least that's what I tell myself every day as I get closer and closer to the mark. Also, you need to have 40 work quarters or 10 years of paying into the Social Security taxes with covered employment. If you have that, you will get Part A at no cost. Part B, we talked before about the monthly premium. Part C will vary depending upon which plan you pick up, and the mix of benefits that they have will determine what the premium is. Premiums for Medicare plans start as low as $0, and they can go up. A gentleman just asked me about supplemental plans. There's also plans that fall under Part C called Medigap policies, and there are another insurance company here, other insurance representatives, and any of us could talk to you about how those plans work, so please grab one of us. Also, Part D, that's the drug benefit. The premium can also vary if you pick up a standalone drug plan. They start at about $14 in Hawaii, and they go up, again, depending upon how much of the copayment that they cover. Now, in very, very small print, when we're talking about eligibility, I say if you're married, you may receive benefits under a spouse's work record. But a very important thing to understand is what it says under that is may also receive benefits under a former spouse if married at least 10 years. So if you don't have enough work credits on your own, but you're married and your spouse does, if you've been married like 9 years and 364 days, just hang in there and stay married one more day. Because the benefit that may, accrue to you can be very, very valuable. So I encourage marriage, and I think this is a very excellent reason to stay married. You're better off. It's too expensive not to be married. Enrollment periods. There's enrollment periods when we talk about Medicare. Enrollment period 3 months before you turn 65, the month of your birthday, so that's a nice birthday present, Medicare, and up to 3 months after your 65th birthday. The reason these enrollment periods are important is because there are certain penalties if you don't qualify for a special enrollment period. And there you have special enrollment period. There's a special enrollment period, and sometimes you can delay your Part B if you're still working once you reach 65 and you have a group plan. But your group plan must be primary. So again, that's why it's important to talk to someone. I always direct people to talk to your HR benefits manager. For those who work for smaller companies, I know at AlohaCare we have an outreach team, and we work with small businesses to conduct conduct retiree workshops on Medicare, and we can help you get set up. The general enrollment period for people who did not enroll in Medicare when they first could is January 1st through March 31st of each year, but it won't become effective until July 1st. So again, the reason that it's important to understand this is there could be penalties, and also if there's a catastrophic illness that might occur, you don't want to be, without coverage. So very, very important to take note of these enrollment periods. I have another slide here. I say before you plan your 65th birthday party, find out how your health plan works with Medicare. Yesterday we were at a company, and I guess there were about 30, 40 people there, and this woman, she looked beautiful, and she said, oh, I'll be 65 in another month or so, so I'm really glad I attended this workshop, because she had not gone ahead to find out how Medicare will work with her employer coverage. And she needed to actually enroll in Part B. So she really, really was appreciative to learn about those enrollment periods. I'm not going to talk too much about this, but I have this slide to be or not to take Medicare Part B. But when people are still working and they turn 65, they do get to decide whether or not they want to take the B or not. So again, if you want to talk about that, you can catch one of us after. Delaying Part B, I just say think twice. Always ask your HR benefits manager. There's penalties involved, just like what Trudi covered with the drug plan. So you definitely need to talk to someone if you decide to delay your Part B. Medicare coordination. What's really nice about Medicare too, if you have another plan, say a spouse's plan, and you have Medicare, the two plans will coordinate. So you could substantially reduce what you pay out of pocket by having, say, a spouse's coverage and also your Medicare. So again, lots and lots to learn about the Medicare program. Another caveat, some people, this has happened to them, maybe they worked for a union and they have retiree coverage under the union, but around October, when all of these plans start advertising, everybody get all those advertisements, you see all those videos playing on TV, I hope to have one too. But anyway, you get all that information. If you have union retiree coverage and you join one of those plans, it can bump you from the union coverage and you can't get it back. And the union coverage in all likelihood is much richer. And Trudi and I and Scott, we've had people come to us in tears and they said, oh my goodness, I got a call from somebody, I think it was Reader's Digest, and we signed up over the phone for a Part D drug plan and it kicked us out of our EUTF drug plan and we can't get back. So again, I'm so thankful that I work for a company whose focus is on education and educating people about Medicare. There's also something called COBRA. COBRA is health insurance that you get if your plan ends or if you leave the company. So very important to understand how Medicare coordinates with COBRA as well. Just a summary and some useful tips. Each plan is different. If you're working, always contact your benefits manager to learn more about how it works. You also want to call Social Security to find out if and when you need to apply for Part B. And my last bullet there is keep detailed notes and documentation when you contact your plan or Social Security, because the beauty, what I love about what the government is doing now, if you receive incorrect information and you make a decision that causes a penalty in your Part B or your Part D, and you have your notes, you say August 9th, it was Martha, and she told me XYZ, they will actually consider that and they may waive the penalty. And we've had a lot of those as well. As a matter of fact, I think we love calling Medicare. We're Medicare junkies, like 1-800-MEDICARE. We love calling Medicare. So also remember to call Medicare. We also have some useful online resources that, since you don't have the slide, the print's probably too small to read. But again, if you leave your information at our table, we'd be more than happy to provide that to you. So I want to just say, before we end, does anybody have any questions? Wow, then I must have did a really good job. Oh, we have a question. Yes, what is your question? That's excellent. We have somebody who's very, very wise. Her question is, if you want to enroll in a Medicare Advantage plan, do you have to be enrolled in Part A and Part B? And the answer is yes. That's absolutely correct. You need to be enrolled in both. Are there any other questions? Yes. Does AlohaCare have a dental plan? AlohaCare does not have a dental plan within their Medicare Advantage plan, but there are some other Medicare Advantage plans here locally that are available that do have dental. And AlohaCare is here. The manager, I know her well, Cheryl Barr, she's somewhere out there, and she can talk to you about that. Any other questions? Yes. Vision plans. Vision plans, let me explain how they work. Original Medicare, they do not cover routine vision care. So if you just want to go get a checkup, which is really a good idea, it's not covered. However, if you have cataracts or macular degeneration or some other type of disease state in the eye, then that would be covered by Medicare. Many Medicare Advantage plans, when I talked a little bit about, they cover more than original Medicare does. Many Medicare Advantage plans do have a vision benefit. It's a supplemental benefit, so you could possibly get a checkup, maybe some money towards eyeglasses. So it's important to talk to each plan to find out what their vision might carry. But original Medicare does not cover routine vision, and original Medicare does not cover routine dental. Any other questions? Okay, well, I want to say mahalo, and I want to thank you so much for your time. At about 9:55, we will have AARP making a presentation. Jerry Silver will be conducting it. I heard him last year. He's fabulous, so I encourage you to visit some of the exhibitor booths and then come back at about 9:55, and you'll hear from Jerry. Aloha.